having a team of doctors or healthcare providers that are listening to you, that the doctors and other care providers speak to each other?
The people who are the patients need to be represented. They need to have a voice in what's happening.
When you know certain information, you can help yourself and you can help others to help you. And there's a lot of information that we all need to know. Today we live in relatively very good convenience. As I was saying earlier in conversation, we go to the bank, we don't have to get out of our car. We go to a restaurant, a fast food place, we don't have to get out of our car. We can now order our groceries from the grocery store. You don't have to push a basket around the grocery store anymore. Someone will bring it to you. But convenience is a killer. Because while we're sitting, quite often we're also eating. These lifestyles, if we change them somewhat, or if we're very careful about them, may help prevent some of our illnesses and may help manage or cure some others. So that's why it's so important to have medical homes. Many of our patients end up in the emergency room with something that's not a true emergency, but it was urgent. It was necessary to have medical treatment for. The emergency rooms are not the places to go for general medical care. Be informed, be informed, be informed. Thank you.
People can often stay at home much more cheaply than they can be in institutional care. Subsidies for adult daycare, we really need them to be increased. If someone with Alzheimer's can go to the adult daycare center, while the other members of the family work, be fed, be stimulated, have fun, sing, laugh, play games, go home and sleep instead of wandering all night. That's one of the best things that can be done for a person with Alzheimer's. So, I'm just saying, speak up for home health care. Every chance you get. That's the best way to keep people out of institutional care and save money from Medicaid.
Great, thank you so much, Polly.
Now the SHIP program, which again, Seniors Health Insurance Information Program, we are a consumer-based program that is through the Department of Insurance, and we help answer questions from Medicare, Medicare Part D, prescription drug plans, long-term care, Medicare supplements, Medicare Advantage. So, you know, how do we do this? Some of the ways is, first of all, we have a statewide toll-free number. Our toll-free number is 1-800-443-9354. And again, that's Monday through Friday, 8 to 5. Then, along with all of our staff, we have 4 regional managers. And those regional managers help us train volunteers throughout the state. Because in every county, we have a local coordinating agency that is a partner of ours that has trained members to sit down and help counsel individuals in your community. And luckily today, we actually have our local coordinator with us, Margaret Cotton, who is with the Upper Coastal Plains Council. And I just want to encourage each of you to take time to write down some questions before you go to the doctor so that you can get the answers that you're needing.
I was wondering, can a person, an individual, negotiate their own bill with the hospital?
We can look up the hospital, see what their policies are, and we'll tell you, we'll contact you with exactly what their care policies are and how you should approach them. So we'd be happy to do that.
Knowledge is power. Find out stuff. Medication management, stuff Dr. Yvonne was talking about. We can't drug shop, prescription shop is what I call it, and then expect everybody to know what we take. Every time, you know, drugstores don't talk to each other either. So if you got a drug over here and a drug over there and you're not telling anybody, then you could very possibly end up with some issues.
If I didn't have any income
And if I got sick and I went there, they couldn't close the doors on me. They'd have to treat me. Could they see me?
If you don't have Medicare, and you don't have Medicaid, and you don't have another source of insurance,
Every hospital has to have a charity care policy, and that means that below a certain income level, they're going to forgive the bill, or a portion of the bill, like Dr. Vaughn was saying.
We've also want to thank the OIC family for having us here today.